I'm David Landry. I'm the CEO of Spectrum Medical Group and very happy to announce our 20th anniversary as a company. Spectrum formed in 1996. It was the result of a merger of five medical practices. There were two anesthesiology groups, two radiology groups, and a pathology group that formed Spectrum. And at the time, the idea was to create a physician-owned and oriented medical organization that could help influence healthcare policy, healthcare delivery, and ensure that the physician's voice was at the center of that, with their emphasis on patient care and how the physicians wanted to provide medical services and healthcare to patients in the state of Maine. So when Spectrum formed, there were approximately 65 doctors, and they were primarily centered around Maine Medical Center in Portland and Eastern Maine Medical Center in Bangor. And from there was an early interest in expanding into other communities. The thought was that if we could deliver healthcare on a regional basis and evolve medical practice from what was traditionally a very generalist type of model, and as medicine became much more complex and subspecialized, we were hoping to bring subspecialty medical care out into the communities of Maine. So part of our growth was in parallel to hospital consolidation that occurred here in Maine. Spectrum grew from a small medical practice to one of the larger healthcare organizations in the state. We then began providing services in New Hampshire and northern Massachusetts. Many hospitals and other healthcare providers came to us because we could deliver the care at a lower cost. We were able to invest in quality and other performance improvement programs that smaller organizations couldn't. And we started to develop a reputation, first geographically here in the Northeast, and then over time a national reputation, especially as it related to some of our quality improvement programs. So by 2005, Spectrum was up to almost 200 physicians. We had over 200 employees. We provided services in all 16 counties of Maine, as well as parts of New Hampshire and Massachusetts. We touched over 300,000 Maine citizens and another 40 to 50,000 citizens from northern New England. In the mid-2000s, we started to expand beyond those initial specialties. And some of the milestones there included the creation of an independent practice association around 2010, and that was a collection of 11 medical practices, all with a similar vision of physician-oriented and directed healthcare. From there, Spectrum began providing services in orthopedics, first with the merger of Orthopedic Associates into Spectrum in 2014, and then subsequently with the merger of Central Maine Orthopedics into Spectrum in 2016. We are now the largest non-hospital provider of healthcare services in northern New England. And we provide that across 20 different subspecialty practice areas. When I think about the ethics that our physicians have, it really is something that I'm proud of. So that's at the highest level. Having worked with physicians and medical groups and health systems my entire professional career, I think what we have here at Spectrum is somewhat unique. That people come to work because we're doing good things by our patients. It's a lot of motivation, and that's infectious. And we have almost a 20-year history of essentially taking revenue off the top and using that to invest back in our communities. We provide over $10 million in free care to patients that can't afford their medical services. So, those, again, it speaks to the leadership and dedication of the physicians that they're here to support not only our patients, but the communities that we live in. Dr. Chris Pope was the original president of Spectrum, a radiologist. He and Dr. Catherine Pope, who was an anesthesiologist and was head of the largest anesthesiology group in Maine, had the initial vision about putting this together. They were joined by colleagues John Long and Michael Pankow, the radiologist from the Bangor community, John Franklin, an anesthesiologist from the Bangor community, and Michael Jones, a pathologist in Portland. And those physicians and others were the core leaders that spent countless hours contemplating what would a organization look like, why would it be different, what could we do together that could create more synergy than being apart. As with most great organizations, they had the vision, they founded it. The work that's been done since then has been other people standing on their shoulders to improve the organization. And that's why I imagine for the future. We're at a place now with nearly 700 employees, providing over 1 million healthcare services a year. The next generation of physician and non-physician leaders of Spectrum will stand on our shoulders and take this to the next level over the next 20 years.